patients. Dr. Myers is a clinical associate professor of medicine at the University of British Columbia, an interventional respirologist at the Vancouver General Hospital. She's the lead for the BC Cancer Smoking Cessation Program and the principal investigator of the Leung Breathomics Lab. Dr. Myers.
Well, good morning, and thank you for the invitation to present our work. Thank you for the introduction. I'm going to be talking about our work performed in Vancouver, Canada, about the evaluation of outdoor air pollution exposure, specifically to PM 2.5 in female non-smoking lung cancer patients. So more females than males who never smoked tobacco have lung cancer. And in fact, the number of lung cancer in patients who have never used tobacco is anticipated to be higher than people who have used tobacco over the next 25 years. Air pollution is a major cause of lung cancer in people who have never smoked tobacco, and in fact, the global burden of disease has accounted for 15% of all lung cancers, secondary to PM 2.5, second only to tobacco. The effect of air pollution may take 15 to 20 years to be reflected in lung adenocarcinoma incidence rates, and the duration of past exposure to PM 2.5 relevant to the assessment of lung cancer risk has really not been characterized. And that was really the objective of our study, is to look at comparing the cumulative 3-year versus 20-year PM 2.5 exposure in female patients who have never smoked but were newly diagnosed with lung cancer. And I just want to briefly describe PM 2.5, which is the particulate matter in air pollution that is 2.5 micrograms or less. And that's what I'm going to be referring to. So all females that were newly diagnosed at the BC Cancer Centre in Vancouver, Canada, as well as a thoracic surgery clinic, who had never smoked tobacco, were asked to participate in this study. They underwent a very detailed residential history, and this allowed us to track their entire lifespan from their current address dating back to where they were born and input this into a geographical information system. This was very granular data. We needed postal codes from each address, and this allowed us very accurate linking with satellite PM 2.5 data that dates back to 1996. We have very accurate satellite data from 96 going forward. We then created a model that we were able to quantify the cumulative exposure to PM 2.5 with high spatial resolution. And we compared the magnitude of a 3-year versus a 20-year exposure. So this was the cohort. We were able to recruit 236 female patients who were newly diagnosed with lung cancer. As you can see here, the majority were Asians at 71.2%. The majority were also born outside of Canada, with foreign-born being 79.7%, and the country of origin most commonly with greater than 51.1% from China and Hong Kong and the rest of Asia. 92.8% had adenocarcinomas, and unfortunately 56% were a later stage, stage 3 to 4. We had a very high EGFR mutation rate at 46.7% in this cohort. And so when we look at the 3-year versus 20-year weighted cumulative exposure to PM 2.5 in this group, when we look at the 188 foreign-born Canadians, if you look at just their 3-year exposure, and I don't have a, pointer, but if you look at their 3-year exposure, only 2.1% would have an exposure of greater than 10 micrograms per cubic meter. But if you do a 20-year cumulative exposure, 20% have an exposure greater than 10 micrograms per cubic meter, and this is statistically significant. Of note, only one participant actually had a PM 2.5 of less than 5 micrograms per meter cubed, which is actually what is recommended as, if we know, a safe exposure rate by the World Health Organization. Oops. Press F5. Thank you. Nope. Okay. Sorry about that. Because we had such a high incidence of EGFR mutation in this cohort, we wanted to see, was there an association with the level of PM 2.5 exposure and EGFR? And in fact, there was. There was a significant association with EGFR mutation in the 3-year cumulative exposure. Interestingly, this was lost in the 20-year cumulative exposure. So higher PM 2.5 exposure in patients with EGFR mutation was only observed in that shorter-term exposure comparison, making us think that perhaps this could be a promoter. The significance of this study demonstrates, sorry, it's like on an automatic thing here. Okay. It's a little challenge, thank you. So the significance of this study really captures that short-term, or at least less than 3-year cumulative exposure risk for PM 2.5 will probably underestimate the adverse health effects that chronic exposure to air pollution has, especially among patients who have lived elsewhere that may have had higher exposure throughout their lifetime than where you actually meet them. And I just wanted to draw your attention to the figure here demonstrating the mortality associated with PM 2.5 and the risk ratio that goes up over time. It's more accurate at least at 8 years of cumulative exposure. And you can see that over time we have national committees and the World Health Organization has been rapidly reducing what we feel is a safe exposure. And I'll point out that it's now 5. When we did the study, it was 10, and that's why we chose 10 micrograms per cubic meter as the cutoff. And so it'll be interesting to see now when we lower that where patients fall. So I want to thank our sponsors, but who I really want to thank are the patients who volunteered for these lengthy questionnaires at a very difficult time on their cancer journey. Usually it was the first appointment at the cancer center, so thank you to the patients who made this possible.